We are here with Dr. Thomas Florack talking about total hip replacements. Dr. Florack, at what point is it determined that someone could have a hip replacement?
Well, someone can have a hip replacement anytime they've got arthritis in their hip, but usually somebody will choose that it's time to have a hip replacement when the pain in their hip is interfering with their quality of life and what they can do.
What does Prevea Orthopedics offer when it comes to total hip replacement procedures? Because they're not all the same.
Well, we have skilled providers at all of our sites who perform the 3 different approaches. There's an anterior approach done with the HANA table, a lateral approach, and posterior approach. We have providers who perform all of these approaches.
And what does recovery look like after a total hip replacement?
Well, most people will go home with some help for a few days to a week using a walker. Over about 2 to 4 weeks, most people change and switch over to a cane. So to the point where by about 4 to 6 weeks out, people are able to go to church, go to the store, go back to office type jobs.
Are there treatment options other than total hip replacement?
Well, usually we start with non-surgical care when you're dealing with arthritis of the hip. We use activity modification, changing how far you walk if that works for you. For some people it doesn't. Medications. Injections are unfortunately rarely beneficial long term.
And what does Prevea Orthopedics do to ensure patients can feel at ease and to achieve the best possible outcomes?
Well, we do a lot of education. It starts in your office visit when you're speaking to the physician and to their assistant. And then it leads on to the joint coordinators that we have through the hospital that will provide knowledge of what's going to happen and set you up in the best possibility for success.
For a complete list of Prevea orthopedic providers in Wisconsin and for more resources, visit prevea.com/ortho.